In this video, we are looking at the second part of Osteogenesis Imperfecta. Here we'll be dealing on the topics, the diagnostic measures, the treatment modalities, any preventive methods, the potential complications, and the prognosis of OI. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. Osteogenesis imperfecta is a group of potentially life-threatening genetic disorders that affect the development of normal collagen cells and result in bone fragility. Hence the name brittle bone disease. This can result in serious neurological, cardiopulmonary, and musculoskeletal complications. However, there are a variety of genetic mutations and disease severities that are possible. Look at the lab tests that are useful in detecting OI. Genetic testing may be used for mutations in genes such as POL1A1 or POL1A2. Additional lab tests may include chorionic villus biopsy, amniocentesis during pregnancy, which we'll be dealing with in the next slide. We can also check the alkaline phosphatase levels. The reason why this is checked is the values are usually typically normal or slightly elevated. While ALP is crucial for bone mineralization, the primary defect in OI is in the collagen matrix and not the enzyme itself. OI patients generally have sufficient active ALP, though histochemical studies may show reduced localization in OI osteoblasts, suggesting potential functional or quantity differences at the tissue level. Let's look at the prenatal testing. It involves non-invasive and invasive tests that are used during pregnancy for the identification of OI and other birth anomalies. The non-invasive prenatal testing, NIPT, uses fetal DNA from the mother's bloodstream for prenatal testing of OI. It is used from the 7th to 10th week of gestation. The next one is ultrasound. It allows to discover severe OI cases from 20th week of gestation non-invasively. The next is chorionic villus sampling. This is an invasive sampling of the placental tissue for further genetic analysis of OI. This is used from 10 to 12 weeks of gestation. Next is cordocentesis. It is an invasive sampling of umbilical cord blood for further OI genetic analysis. This is used from 22nd to 24th weeks of gestation. The last one is amniocentesis. This is an invasive sampling of amniotic fluid for further OI genetic analysis used from 15 to 20th weeks of gestation. Imaging tests. Imaging tests that are used to diagnose OI include X-rays to diagnose vertebral and long bone fractures, neurological imaging tests to diagnose and evaluate neurological complications such as hydrocephalus. Diagnostic tests and procedures. Cardiac diagnostic tests and procedures to diagnose any cardiac complications. Pulmonary function tests to diagnose and monitor respiratory complications. Sleep study with capnography for obstructive sleep apnea and or as a substitute for pulmonary function tests in young children. Neuropsychological tests for patients with cognitive impairment and social behavior, learning, or emotional difficulties. These can be done to find out other complications that are caused due to OI. Let's considerations. Interprofessional care is required for patients with OI, including neurology, cardiology, pulmonology, psychiatry, audiology, pain management, orthopedic surgery, and rehabilitation. Pharmacological therapies include growth hormones, calcium, and bisphosphonates to improve bone mass density and reduce the risk of fractures. Orthopedic surgeries such as total joint replacement and open reduction internal fixation may be necessary to treat fractures and deformities. Spinal corrections may also be necessary to treat spinal deformities. Experimental procedures and new therapies are also taken into consideration in the treatment of OI. They include gene therapy, stem cell therapy, and use of medications that decrease bone reabsorption. Example, bisphosphonates, denosumab, estrogen therapy, and cathepsin K inhibitors. It focuses on reducing the impact of complications on mobility, communication, self-care, safety, and comfort. All therapies include family or caregiver training so that the patient can be safely cared for at home upon discharge. Physical therapy for ambulatory assisted device and or wheelchair fitting, aid, lift devices and or wheelchair training, fall prevention education, therapeutic exercise, and post-surgical rehabilitation as appropriate can be planned. In occupational therapy for ADL training, that is activities of daily living, fall prevention strategies, therapeutic exercise, adaptive equipment training for home as well as school, and post-surgical rehabilitation as appropriate. Speech therapy for swallowing evaluation and therapy, augmentative and alternative communication evaluation and training as appropriate. Cochlear implants may be indicated for patients with hearing loss. Psychological counseling can be done to provide emotional support, enhance coping skills, and promote functional abilities. Let's look at the potential complications of OI. Complications of OI may vary depending upon the type of genetic mutation and may include limited lifespan and functional level, neurological complications such as macrocephaly, which is abnormally enlarged head, hydrocephalus. Here, there is too much CSF or cerebrospinal fluid buildup in the brain's cavities, which are otherwise called ventricles, causing increased pressure on the surrounding brain tissue. Blindness, headache, dysphagia, that is difficulty in swallowing, hearing loss, impaired sensation, and platybasia, which is an abnormal congenital or acquired flattening of the base of the skull, where the upper part of the cervical spine pushes the skull base upward. Cardiopulmonary complications include mitral valve prolapse, cardiovascular disease, aortic regurgitation, pneumonia, asthma, infections, and restrictive pulmonary disease. GI complications include constipation and gastroesophageal reflux disease. Adverse psychological responses that can occur are fear, depression, and anxiety. Musculoskeletal complications include tendon ruptures, osteoarthritis, bony deformities, chronic pain, dentinogenesis imperfecta, which is a genetic disorder that affects the dental layer of the teeth, causing internal structural issues, osteoarthritis, and weakness. Prevention of OI. Genetic testing and counseling are advised for couples who have a relative with OI. There is no prevention of OI as it is a genetic disorder. Prognosis, which means the outcome of a disorder. There are several factors that can influence it. In this case, let's look at the type of OI. This is the most important factor. Type 1, which is a mild form, people can expect a normal lifespan. Type 2, it is severe, often leads to death in the first year of life. Type 3 is associated with significantly shortened lifespans and severe deformities. Type 4, the severity varies, but life expectancy is generally moderately reduced. Next is the fracture history. It depends upon the age of onset and frequency of fractures that are significant indicators of mobility and overall outcome. Next, respiratory status. Respiratory failure is a frequent cause of death in people with severe OI. Next is the severity of skeletal deformities. Severe bone deformities such as spinal curvature and barrel chest are linked to a poorer outlook. And early motor milestones. Achieving early motor skills like sitting is associated with the ability to walk. References for this part of the Osteogenesis Imperfecta video. Thank you for the patient listening. Hope it was useful.